This is a Milwaukee PBS Listen MKE special presentation.
Good afternoon, Milwaukee, and welcome to Listen MKE, a partnership between WUWM, Milwaukee's NPR, the Ideas Lab at the Milwaukee Journal-Sentinel, the Milwaukee Public Library, and Milwaukee Public Television. I am Investigative Solutions reporter Talis Shelbourne with the Milwaukee Journal-Sentinel, and I am joined by a panel of doctors who are here to talk about vaccine hesitancy. Throughout this Listen MKE, we'll also be answering questions from Milwaukeeans, thanks to special reporting from Sarah Volpenheim. With us today, Dr. Lyle Ignace, the CEO of Gerald L. Ignace Indian Health Center, Dr. Kevin Izzard, Chair of Family Medicine at St. Joseph's Hospital and former president of the Cream City Medical Society, and we have Dr. Zeno Franco, an associate professor at the Medical College of Wisconsin. All of you have worked on outreach this past year and have to provide good information about preventing the spread of COVID-19 and also getting vaccinated against this disease. So to get started, I'd like each of you to take a moment to briefly describe your experience with vaccine-hesitant patients. We'll start with whoever's in my top right corner, and that is Dr. Ignace. So that's you, yes.
Yeah, welcome. Thank you, and appreciate being on the show. Thank you for the opportunity. So, yeah, you know, with the launching of the vaccines with Moderna, Pfizer, J&J, we've had all types of reasons why individuals didn't want to get vaccinated, and their hesitancy, you know, generally revolves around the idea that this was generated too fast. Wasn't FDA approved? Is it safe enough? And you know, a general mistrust of authority figures in promoting the vaccine, and that's really how this has been going, especially over the last 3 months. It's pretty significant, and but we try to be as informative as possible and get the information out and assure that the general public as a whole and our communities of color understand the importance of getting vaccinated.
Dr. Franco, what has been your experience?
Yeah, I mean, I think it's the same things that Dr. Ignace is mentioning. There was a lot of interest early on, and then we saw a significant drop-off in people getting the vaccination. There are all sorts of concerns out there about the vaccine. I think in a sense, one of the mistakes that we can make as a society is sort of brushing off those concerns and not dealing with them seriously, sort of trying to say, well, these people are not acting rationally, and so we're just gonna write it off. I think sometimes people just need a little bit more intensive conversation about sort of, you know, exactly, again, what Dr. Ignace was mentioning, like how was the vaccine developed? A lot of people don't realize that there's been a lot of work done on mRNA technology over a 10-year period or more leading up to this vaccine. So, you know, when we kind of brush off the conversation, I think that's when we get stuck.
Gotcha. And last but not least, I want to make sure I'm pronouncing this right. It's Dr. Izzard or Izzard? Dr. Izzard. Okay, yes. What has been your experience with the vaccine hesitant patients? Oh, I think you're muted. Quite sure.
I am muted. Okay. Yeah. So they both hit it right on the head. You know, it's issues of mistrust, issues of misinformation. But I think the hardest part right now is running into a lot of people who consider this a civil liberties issue. And unfortunately, the harder you push, the harder they push back. And regardless of what information you give them, regardless of what information you can show them, you know, that's convincing, it just becomes an issue of you can't make me do it. And the more you try to make me do it, the more I'm not going to do it. And so, so unfortunately, you know, we can educate people about some of the misinformation. You know, as far as the mistrust, that's a harder issue also, but, you know, definitely if people are dead set against it, you know, there's not a whole lot you can do to convince them.
Where they make the vaccine and how do they know that it works? So that was one of the questions that Mr. Bond had. Who wants to grab that one?
Well, I can maybe take a stab at that. So, the vaccines are, they're major. So one of the advantages of having the mRNA technology is that with the old technology we had, like with the flu shots, at least the older ones, we'd have to use animal models. So we'd have to grow the virus on chicken embryos. Because this is a new technology, this mRNA, they can actually just mix this stuff up in a test tube, and so you don't have any animals, at least at this point, involved in the manufacture of it. The question about how do we know it's safe? It is a new vaccine. It is a relatively new technology, but as Dr. Frankel was saying, back in 2003, there was a virus that caused a lot of concern, SARS, and we call this virus, the one we're dealing with now, the coronavirus, is SARS-CoV-2. And the reason why it has that name is because there was a SARS-CoV-1, and that was SARS, the initial infection that we were afraid was going to become pandemic like this was. It did not become pandemic. It wasn't as contagious, and people did jump on it right away. But because of that, there was a lot of concern that this was going to become a pandemic infection. It was novel, meaning that no one had exposure to it or immunity to it. And so they started working on vaccines then. And so some of this mRNA technology really began back in 2003 when that outbreak happened, even before then. So as Dr. Frankel was saying, this isn't really anything that just started back in January. This actually, January of 2020, this actually started, back in 2003. And because there was no incentive, because it didn't become a pandemic, there was no real incentive for the researchers to get this into market, because there was no one was getting vaccinated for it because there was no pandemic. So when this pandemic happened, and people realized it was a very similar virus, the government said, look, we need to have a vaccine, and it said, whatever you're working on, we will pay you, we will incentivize you to finish the research and to get it to market. And so it makes sense that, you had a lot of collaboration and there was a big push to get this thing out. But again, it wasn't because, this was made completely whole cloth, beginning after this pandemic started. It really was already there. There was just no incentive to get it done. A lot of this stuff really got combined. And so the efficacy, meaning, whether it's safe, or the efficacy, whether it's effective, and the safety studies were done together. And so probably the best argument for the safety of this vaccine is that we've had almost 2 million people who have been vaccinated against this. And there are very few medications that have that big of a study group. They'll tell you whether it's safe and effective. And so, if there's something bad, it would have shown up, a lot earlier. And so overall, when you weigh the risk of this new vaccine versus the risk of having a bad outcome from COVID, your risk of having COVID is a lot higher than any possible risk that you're going to get from this vaccine, especially after having so many people have gotten it. So, that was what convinced me, was the fact that definitely the benefit of this medication outweighs any risk that there would be.
Next up, we have a question from Mount Mary University student Alexis Kane. If we can show that video.
How can you ease the minds of people who are concerned about negative long-term effects of the vaccine?
Yeah, I can jump on that one a little bit. So again, we actually had some questions from the community health workers that we were working with exactly about that question. Do we really know what the long-term effects are from an mRNA-based vaccine? And I think, we're relatively assured that the sort of short-term effects are minimal, right? There are some side effects. And I think that's one of the things we have to be honest and open with the community about too.
Right.
We know that there will be a few people that do have some side effects from any vaccine. That's just reality, right? We don't have a complete picture on long-term safety for the current vaccine. That's also a reality. And I think we need to be open about that. We have every reason to believe that this vaccine won't impact people much beyond a couple of days where they're having some immediate side effects. But we don't have complete data yet on the long-term effects. And I think that we need to tell people that, right? And we're trying to work on that. And that's really where We actually are starting to now have the vaccine in place for many months, and we're starting to see safety data that's getting to be longer term. What we understand about mRNA is that it's not able to go back into the cell nucleus, right? It's something that's transported actually away from the cell nucleus. And so I think one of the biggest concerns that I've heard in the minority communities, the communities of color that I work with, is that somehow this vaccine has been designed to alter human DNA, right? And that's a concern that's come up many, many times in very different contexts. And I think we, as a healthcare establishment, as healthcare institutions, we have to do a better job of actually translating what we know about how mRNA transport works. Again, so that the person on the street who's concerned about these sort of long-term effects can really get their hands around the idea that there's no change to the cellular structure that is, I think, one of the deepest concerns that people have. And we forget that when something is novel as this vaccine is, it's natural human instinct to be a little bit wary, right? We're not sure. That's the sort of high consequence, low information scenario is where people naturally are going to be concerned. And we have to meet that with as much information as we have and also be honest about what we don't know yet.
Can you talk about the vaccine's impact on young people and this virus, this particular variant, especially this variant's impact on younger people compared to what we saw earlier in the pandemic?
I'll try to address that. So, in the beginning, we heard the devastation that it has impacted kind of our older generations. And we weren't seeing a lot of younger individuals succumbing to COVID. With the introduction of vaccines now, obviously our older generation are really well vaccinated, but now it's our younger generation that's lagging behind. As a result, obviously we're seeing more younger individuals getting COVID, but at the same time, we know that COVID in younger people don't have the same illness course. Some may have very asymptomatic, very mild, moderate, and rarely do we see younger individuals, and I'm talking younger, like less than 35, run the course of severe disease in the hospital. So, it's kind of, it's counterintuitive to think that, COVID is going to react the same in everyone. And as a result, we're seeing a much different picture on the front lines where, yes, young individuals do get COVID, but they, it's equated to as maybe a bad cold at worst, maybe a bad flu, but for the most part, they recover and do absolutely fine within a short period of time. So it gives a false impression for younger individuals who I think feel their invincibility and being able to handle this and recover without any problems. It gives a mixed message to, let's say older age groups that may feel the same way, but obviously have much different courses and even fatal outcomes. And so we just have this entire spectrum of age groups that obviously are impacted very differently, and that's the hard part. That's the hard part, to convey a message to younger people that this is important, not just in the reduction of transmission, but actually, transmission within families who may have older generations or who have multi-generational living. These are important factors for younger people to take into consideration, which I don't feel they do all the time. So
you all work in the fields of outreach. So this is a question for all of you. What advice would you give people who have vaccine hesitant friends, family members, and are concerned about them, want to encourage them to get vaccinated, and want to do it in the best, most effective way possible?
I'll take certainly a try at this. So I think it's important to contact your healthcare provider, because they're more than likely going to be the individuals that have the latest information. And have a much broader perspective and be able to answer people's questions directly in the moment. So, we could certainly talk to groups of people, but when it comes to more of the interpersonal relationship between you and your provider, I think it's important, and having the moment to be able to ask and have all your questions answered in the moment it is certainly a lot more powerful one-on-one.
I agree, and when you do the research, because we live in an age now where you can Google almost anything. Use reputable sites. Use the CDC. Use places that that have reputable information versus Joe's COVID site. Because anybody can do a blog or do a sort of website and have information that's not necessarily accurate. And I also would resist this temptation because a lot of us are getting compassion fatigue. We kind of dealt with this. We've been dealing with this. We got to a point where it looked like things were getting better. We got to take our masks off, and now the masks are back on, and people are frustrated. And so, I would say resist the temptation to blame and to fight about it, because again, all your happens kind of going back to our civil liberties issue. People just dig their heels in more strongly, if you feel like you're making them do something. And so, incentives. We try to incentivize people. We're giving $100 in Wisconsin if you get vaccinated. So we're trying to use the carrot. In some cases, only the stick's going to work. So companies mandating people to get vaccinated or to be tested. But again, try to resist that urge to strike out in anger, because nothing comes of that.
Yeah, I think all those things, right? So I think talking with the provider is super important. A lot of people really respect their providers as a sort of authority on this stuff. And so I think for the healthcare system and for all the work that we're doing, asking people, can you just go talk to your primary care provider about it so you have a better understanding from somebody that you trust? That's a huge thing. I also think that we have, I think in COVID, seen a lot of personal leadership come up, right? And so I've watched individuals from communities of color that I am working with just tell their story, right? Just say, this is what I'm doing, rather than saying, you should do X, Y, Z thing. I work with a African-American executive director of a nonprofit here in Milwaukee. And, he's just a guy that a lot of people know. And so what did he do when he got his first vaccine shot? He took a picture of it. This was very early days, right? And he put it up on Facebook. And I mean, there he is in his t-shirt or whatever, it's more, it takes some risk to just sort of put up this very personal shot of you getting the vaccine dose, right? And about 68 people commented on it and asked questions. And for me too, when I went and got the vaccine, kind of based on what he was doing, I said, this is how he's approaching it. I actually talked through the symptoms that I had from the second dose with all of my neighbors, right? I had a little bit of muscles, sort of soreness and some stiffness for maybe 90 minutes or 2 hours, and I was a little tired. And I just said, this is what I experienced. I didn't have anything in the first dose. This is what the second dose looked like. And when I go back and talk to them now, I say, I haven't had any problems since that time. And I think that helps people. I'm not telling them you should do this, right? I'm saying this is what I experienced, and it wasn't a big deal. But I also think that, I had a neighbor who said, I don't mind getting the vaccine for myself, but I do have some worries for my daughter, right? And we have daughters that are about the same age. And it actually made me pause and think about this for a minute, right? I'm old, if something goes wrong, it's not that big of a deal. I've lived my life. But you've got young children in your home and you're thinking, are there long-term consequences for these kids? And we had to really think about it for a minute. We don't know everything about this vaccine. But to the point that the physicians on the call are making, right, is that the risks for getting COVID are so much higher than the risks of the vaccine. And we made a decision in our house that even though we don't have every single fact in place, I don't want my kids to experience long-term COVID. I don't want them to, have any of the problems that are associated with this infection. And they're going back to school. And I mean, I hate to say, but schools, on a good day, schools are a petri dish, even with all of the infection control strategies, it's worrisome as a parent. And so we made a decision as a family that we vaccinated the oldest one, and as soon as the other one is eligible, we're going to have him vaccinated too. And, you know, I think we're just trying to talk that through with people that we know. These are the decisions that we've come to as a family.
You know,
Gotcha.
Dr. Frankel said something that I think that's very important, is that you have to acknowledge people's, you know, the hesitancy that they have and where it's coming from. You know, so and be honest about the things you don't know, because there's a whole lot about this you don't know, and you acknowledge that. You know, when we talked about, you know, the overall long-term safety, we don't know. You know, we have some pretty good ideas, but we don't know with a certainty. And so when people hear things that, you know, that doesn't fit with, you know, with maybe what they're expecting, you know, they're a little more resistant. But if we acknowledge, okay, I understand why you're hesitant. I understand why, you know, you might be fearful of this, or why as a parent you're concerned about your child getting vaccinated. And I think when you acknowledge those things, people can hear you in a different way than if you come at them, you know, as you're stupid, or you're just making things up, or you know, then they become defensive and they don't hear anything after that.
Next, we have a question from Nina Ross. Here's her question.
I think maybe if they would talk more about the success rate and how that looks versus the negative information that's out now, with people saying, hey, you were vaccinated, but we still got COVID. I think if they could debunk that, that would maybe help some people come off the fence.
So yeah, I want to paraphrase kind of a question from that, which is, what is the definition of successful vaccination in this context? Because from my understanding, it doesn't mean that you will never get COVID. It means that you're less likely to get very sick from COVID. So can you just talk and expound upon that?
I think there's several ways you could probably view or even acknowledge success. Obviously, when you look at vaccinated, unvaccinated, I think that's kind of the starting block as to say who gets COVID, who doesn't, and you start looking at rates of infection. Then you can start looking at comparisons between vaccinated and unvaccinated of hospitalization rates, ICU rates, and even fatalities. So when you start looking at comparing, or start defining what success looks like, we know as information is coming out that we do know that people who get vaccinated will get COVID. It's a low rate, but at the same time, if you do get it, that your risk of severe disease or hospitalization dramatically goes down. And you start comparing that to people who are not vaccinated, it tells a much different story. So I think it's important to highlight the effectiveness and what the true impact is on individuals and their ability to maneuver through and recover from COVID versus the unvaccinated. It tells two different stories.
Gotcha. And if either of you want to jump in on that as well, the definition of a success for this vaccine.
Yeah. So, I think one of the things too that we've forgotten, right, is that there have been other major healthcare scares in our history. So with the polio vaccine, that's one of the most significant successes in this sort of, vaccination battle against certain types of diseases that have had a profound impact on our society over time. When you go back and really look at that, the breakthrough infection rate even with the polio vaccine in place was still between probably 10 and 15% of people with that protection still getting polio or getting some version of polio. And so I think one of the things is we've forgotten, it's been easy in a sense for us for several decades, right? Things have been kind of cruising along, and we haven't had some of these scares come up in the same way. It's time for us to remember, right? What have we done in the past? What have we experienced in the past in terms of public health? And take some cues from those past situations. So for me, when I hear there's maybe a 5% breakthrough infection rate with the COVID vaccine, I hear success. But I think that doesn't maybe sound like success to the general public because we haven't had this conversation in a long time.
Right.
Gotcha. Did you have anything to add, Dr. Izzard?
Yeah. Again, Dr. Frank always makes good points. I think we need to manage expectations. And even going into this, I tried to explain to people that at some point we're all going to get this, and that the idea is, even with the studies that were done with the vaccine, and those studies, they did not say that people who were successfully vaccinated or immunized, that they did not get infected. The test really tested was, did they get sick? And so when people heard that that we had 95% efficacy from the Pfizer vaccine, people heard, oh, if I take the vaccine, I'm not going to get infected. In reality, what we found out later is that, yeah, some people did get infected. They didn't get sick, and in fact, they didn't get sick enough to even be able to record them as having got COVID, because they didn't know they had it. So we do have these asymptomatic people that would not have shown up in initial studies as being positive, because that study did not look at that. It looked at who ended up in the hospital, who had symptoms of COVID, and who didn't. So again, with anything, it's always about trying to manage expectations. If people are expecting more, they can deliver, they're going to be disappointed. So going forth, we got to make sure that people have a realistic expectation of what's going to happen. If we tell people the vaccine is safe, and they take the vaccine, they get side effects, but no one told them that they're getting side effects, then they feel like something's wrong. As opposed to, if you tell them ahead of time, yeah, this, you might get this, you might get that. You're not gonna, die from it. You're not gonna, it may be just a couple days, you have symptoms, and if it happens, then they're expecting it, and then they're okay with it.
This has been another installment of Listen MKE, a partnership between WUWM, Milwaukee's NPR, the Ideas Lab at the Milwaukee Journal Sentinel, the Milwaukee Public Library, and Milwaukee Public Television.